First aid on emergency childbirth. The first thing to do is to call an ambulance. If medical professionals has not yet arrived, then what you need to do is to assist the mother as the birth is about to happen. Here's what to do. First is to check if the place is safe. Next is to ask permission to the patient that you want to help her in delivering the baby. Next is to help the mother lie down in a comfortable position. Next is provide privacy, especially when it happens in public places. Wash your hands with clean water. Next is do not pull the baby's head and let the woman push the baby out. Next, when the baby is out, gently wipe off the membrane coverings of the mouth and the nose on the baby. Clean the baby with a clean towel or a cloth. Next is wrap the baby with a towel and give it to the mother. Next is to keep the placenta and the umbilical cord. Do not cut the umbilical cord. Next is to bring them to the hospital. So that's it.
Angina is a type of chest pain that someone gets when the arteries carrying blood to the heart muscles become narrow. This restricts the blood supply to the heart and causes pain. This is called an angina attacks. Angina attacks are usually brought on by physical exertion like stress or excitement. But if someone has unstable angina, then attacks can be unpredictable with no obvious triggers. Angina on its own is not life-threatening, but someone who suffers from it is at far greater risk of having life-threatening problem like a heart attack or stroke. If they rest and take their own medication, the pain should only last a few minutes. If the pain lasts longer, then start treating them for a heart attack. If you think someone might having be an angina attack, there are four key signs to look for. Pain in the chest, which may spread to the jaw and arms, shortness of breath, sudden and extreme tiredness, and feelings of anxiety. If someone is having an angina attack, advise them to stop what they're doing and get them rest in a comfortable position. If they have medication, they should take it. If the pain lasts more than 5 minutes, they can take a second dose. So if they're still in pain after 15 minutes, then you should call for an ambulance. they don't have an angina medication and the pain doesn't go away with rest, then call for an ambulance immediately. If the pain goes away completely within the 15 minutes after the rest or medication, they should usually be able to go back to what they were doing before the attack, if it's not too strenuous. So if they're worried about the attack, they should seek medical advice. So remember, when someone is having an angina attack, help them to sit down and rest. Help them to take their medicine if they have some, and call an ambulance if they don't. So if it doesn't get any better within 5 minutes, take a second dose. So if it doesn't get any better after another 5 minutes, call an ambulance. And that's how you treat for an angina attack.
Have you ever eaten type of food or product and in a few hours you feel this type of symptoms? Vomiting, cramping abdominal pain, a burning sensation, decrease in level of response and seizures? You may experiencing food or symptoms of food poisoning. Hi, my name is Sophia and I am now discuss to you or show you how to relieve this kind of symptoms. First, if the patient feels sick, let her drink a homemade aerosol. You may create an oral rehydrated solution that combines 1 liter of water, 8 spoons of sugar, and 1 spoon of salt. So that is how we made an oral homemade rehydrated solution. So you may let the patients drink this oral homemade or what we call aerosol. So for the next is, if the patients feel pain or stomach pain, you may put a hot compress and put it in her or his stomach. But if the symptoms is still poor, then you may call an ambulance and let the patients go to the hospital.